Hi viewers, this is the part 2 of our scenario-based multiple choice questions, and we will start right from the question 6 where we left in our last video. So here is the case scenario on the screen. A 42-year-old man presented to the clinic with complaint of pain in the right knee joint. He had pain and discomfort in the knee and has a fever in the last 5 days. He works in an international bank and frequently travels to the Asia and Australia, from where he had returned 2 weeks ago. There is no significant family history and he takes no medication. On the examination, the temperature is 38.1 degrees Celsius, the pulse is 90 beats per minute, and the blood pressure is 124 by 82 mmHg. His right knee is swollen and slightly tender, and there is small effusion with the slight limitation in the flexion motion. Synovial fluid analysis reveals a white blood count of 50,000 per mm3 with predominant neutrophils. So, which of the following is the most probable cause for this patient's symptoms? Option A, gout. Option B, gonococcal arthritis. Option C, urinary tract infection. Option D, non-gonococcal septic arthritis. So, the correct answer is gonococcal arthritis or the septic arthritis. So here we have the explanation. The patient with fever and the features suggestive of septic arthritis are most likely due to the disseminated gonococcal infection. It is a common cause of septic arthritis as its involvement of the distal joint like knee, wrist, and the ankle joint are most involved joint in the gonococcal arthritis. The suspected patient should undergo a complete history and physical examination. Disseminated gonococcal infection is diagnosed by the joint aspiration and the synovial fluid analysis. So there is a presence of elevated white blood cell count, which indicate this condition known as gonococcal infection or the septic arthritis. So jump to the other scenario, scenario number 7. A 5-year-old boy was brought to the emergency department by his parents to evaluate a rash. He initially had a fever and a runny nose for 1 week. After the fever subsided, a rash began to appear on his face. It looks particularly red over his cheeks. He does not have any history of sore throat and cough. His immunizations are up to date. A few days ago, he went hiking with his friends but had not traveled outside. On physical examination, the patient is irritable and a rash is present over his cheeks and spreading to other body parts, as shown in the picture. On examination, the temperature of the child is 73.8 degrees Celsius, the blood pressure is 90 by 60 mmHg, and the pulse is 101 beats per minute. So, which of the following is the most likely cause for the child's symptom? Option A, Lyme's disease. Option B, scarlet fever. Option C, erythema infection. And the option D, Rosell-Kawasaki disease. And the correct answer is erythema infection or the erythematous infection. And the explanation for this, the child with the onset of fever followed by the characteristic slab cheek appearance rash is consistent with the erythema infection, also known as fifth disease. It is a benign childhood infection caused by the parvovirus B19 and the non-enveloped single-stranded DNA virus. The virus can infect patients of all ages, but it is more common in the children that aged 5 to 15. So on the basis of clinical manifestations, the fever, headache, and the flu-like symptoms like runny nose and congestion, followed by the bright erythematous rash that appear over the face and more common over the cheeks, give the characteristic feature of this condition, known as erythema infection or the erythematous infection. So let's jump to the scenario number 8. A patient has recently been diagnosed with the symptomatic bradycardia. Which of the following medication is the most recognized for the treatment of the symptomatic bradycardia? Option A, Quisteran. Option B, Digitalis. Option C, nitroglycerin. And the option D, atropine. And the correct answer is atropine. And the explanation we have, Atropine is the first-line medication for the treatment of bradycardia. The use of the atropine in the cardiovascular disorders is mainly in the management of the patient with bradycardia. Atropine basically increases the heart rate and the improvement in the atrioventricular conduction by blocking the parasympathetic influence on the heart. Moving toward the next scenario, a patient has suffered a left cerebrovascular accident and has developed severe hemiparesis of the left side, resulting in the loss of mobility. The physical therapist noticed on assessment that an area over the patient's left elbow appears as non-bleachable erythema and the skin is intact. The physical therapist should score the patient as having which of the following? Option A, stage 1 pressure ulcer. Option B, stage 2 pressure ulcers. Option C, stage 3 pressure ulcer. And the option D, stage 4 pressure ulcers. And the correct answer is stage 1 pressure ulcer, the option A. And the explanation we have: pressure injuries are localized area of tissue necrosis that typically develop when the soft tissue is compressed between the bony prominence and with an external surface for the long period of time. These pressure sores only affect the upper layer of your skin. So the stage 1 pressure injuries are characterized by the superficial reddening of the skin, either it's blue, red or purple, that when pressed does not turn into the white or non-bleachable erythema. These pressure injuries may also differ in temperature, either it's warmer or cooler, it's different in consistency, either it's firmer or softer, or maybe more tender than the adjacent tissues. So now see the last scenario of today's lecture. Low back pain is frequently caused by the lumbar disc disease, which is influenced by aging and degenerative cascades. What is the nomenclature specific to lumbar disc disease that involves the breakage of the disc fragment from the nucleus pulposus? So the option A, we have disc bulge. Option B, disc protrusion. Option C, disc sequestration. And the option D, disc extrusion. And the correct answer is option C, disc sequestration. Let's see the explanation. Disc sequestration is a separation of the disc fragment from the nucleus pulposus. On the other hand, in the case of disc bulge, the annulus fibrosis are intact. And in case of protrusion of the disc, that involved in the localized bulging of the disc with damaged annular fibers. And in the last, the disc extrusion involves an extended bulge with destroyed annular fibers, but the disc is still intact. So that's it for this lecture. Please watch the part 3 of this series where you will find the 5 more scenarios with explanation. Thanks for watching.